Healthcare has never been more complicated and more in need of dedicated nurses.
Healthcare is so complex that you need the advanced degrees to understand that complexity and how the systems work together and interact.
Grand Valley State University's Kirkof College of Nursing is meeting the demands of today and tomorrow with its carefully designed curriculum. The college offers a Master of Science in Nursing and a Doctor of Nursing Practice degree, which began in 2009.
We began looking at what educational components need to be adapted in order to create an educational program and to create graduates who have the best preparation to bring about influence and change in healthcare.
The impetus for Grand Valley's DNP was national reports showing that nurses are desperately needed, but not always adequately prepared for the increasingly complex healthcare environment. The reports state, nurses are undereducated for current demands. They lack influence and must develop leadership. Today's nurses must have improved clinical education, and they must learn and foster interprofessional collaboration.
One of the most rewarding things is getting to know the individuals that have chosen to go down this path and to watch them evolve.
Jackie Lubbers graduated from Grand Valley with her MSN in 2000 and has been working as a pediatric nurse practitioner in primary care. She found herself drawn to Grand Valley's DNP.
Good job again.
We will always need people to deliver care at the bedside. But what I was finding in my career is I felt like I kept bumping up against a barrier where I felt like I wanted my contribution to be larger to the profession of nursing. I just didn't have the skills to get beyond that barrier.
Lubbers found that access to health care has become one of her passions, especially in the area of mental illness, matching patients to resources. Grand Valley's DNP curriculum has already helped her with patients.
I had courses in psychopharmacology and mental health theory, all of which help that on a provider to patient level. But we also have lots of courses where we looked at things like health policy.
I knew that at some point I would go back for higher education.
Fred Comer had a bachelor's degree in biology when he pursued his second one in nursing. He appreciates his time with patients.
Just really being available and accessible to somebody at their most vulnerable point.
Comer works at Spectrum Health while taking his classes at Grand Valley. He recognized the DNP would help him obtain administrative positions where he could help transform healthcare.
Many times in those positions to be instrumental in bringing about change or making policy changes or implementing changes, it comes from a higher degree level and works its way down to the bedside. The other side of it is also to be able, from an educational perspective, to help educate new nurses, because there's such a gap in need to help have qualified and well-trained educators.
We have 5 examination rooms that we can use to treat our patients.
Nurses studying at Grand Valley State have a unique opportunity to put service with their classes at the university's Family Health Center. The center is one of about 250 academic nurse-managed systems in the United States, and it offers a variety of opportunities for nursing students.
The unique thing about our health center is that we serve a large number of individuals who otherwise would not have access to care. Individuals that are underinsured, uninsured, have complex not only health needs but complex psychosocial needs that we can bring together coordinated care.
The Family Health Center is in the heart of downtown Grand Rapids and serves more than 2,500 patients each year. About 100 students work with the nurse practitioners to get experience in primary care. This opportunity is just one facet of what attracts students to Grand Valley's advanced nursing degrees.
Most of my career have been in a role where I've had the opportunity to establish systems.
Marie Vander Coy has been a lifelong learner in the nursing profession. She received a diploma in nursing, a bachelor's and master's in nursing, and a certificate in nursing informatics. Along with pursuing her DNP at Grand Valley, Vander Coy works at Spectrum Health. She is impacting nursing practice and clinical reasoning through the use of electronic health records and information technology.
The computer is a reality of a nurse's world. They are going to need to figure out how to care for the patient and use the computer that's in front of them.
Vander Coy, along with her colleagues in Grand Valley's DNP program, decided all the degrees they had were not quite enough for the work that needs to be done, and they made a commitment to themselves and their chosen profession.
When I looked at where I saw healthcare going and looked at Grand Valley's courses, there was such a match. I would be very interested in the future, and I'm having a role that in some way related to establishing public policy.
Being an overseer and running an organization from a nursing perspective, you have to have those higher levels of degrees of education.
Having a doctorate in nursing when you come to the table to speak with physicians and people in physical therapy who have the clinical practice doctorate as their entry, it puts you on an even playing field as well.
Grand Valley State University poses this provocative question: what if you could help transform healthcare? The university's DNP program was designed to show you that you absolutely can.